This has to be one of the most boring subjects, but we're going to go over why that is, and that is because it is regulated medical waste, and that is BUMED Instruction 6280.1, Charlie. Why do I need to know about this for advancement? Let's break that down real quick. And that's because working in medical, you're going to have to get rid of sharps, get rid of medications, get rid of linen, get rid of all these things that might just be byproducts of things that were used. You don't want that inside your water and everything else out in the environment. So we have to have guidance like this. And that's why it's important. And you probably do it already and don't even really think about it. Have you thought about the sharps container that's on the wall? Have you thought about the little bin or area at which you keep this regular medical waste where it just magically disappears and some guy takes it away? Why are all these things important? Why do they happen? And what really tells us how to do that? That is BUMED Instruction 6280, which is the management of regulated medical waste. Not fancy, but we are here to get you on the track to advance to the next rank. So referring to the instruction, because that is the source of this material, it says this guidance is specifically going to be used for your local guidance here. That's what this highlight says. Now, obviously, if you are in an area that does have guidance that supersedes this, that's local, you're stationed Spain, Japan, whatever, you're going to follow that if it's more stringent or whatever their requirements are. And that is something you need to note because you may be stationed over there and your arbitrary requirement might not be applicable to this instruction and advancement. So remember, applicable in real life, applicable towards the advancement exam right here. Now, a lot of you guys read these instructions and have no idea what they're even stating, essentially, because you're like, what is a BUMED BSO 18 facility? If you've ever been stationed over at a medical hospital, an MTF, military treatment facility, that is a BSO 18 facility. Now, if you are stationed with the Marines or something like that, that is an entirely different entity that would cover in their own guidance, but this is specifically for if you're at a clinic or hospital or a medical center or something like that. And to give you that knowledge, it says right here, shipboard medical personnel are governed by the most current version of the Afloat Medical Waste Management Guide. That sounds like a test question right there. What regulates medical waste while you are afloat on the water? The medical officer of the Marine Corps provides separate guidance to Marine Corps activities. As I kind of discussed earlier on the why, it says right here, non-regulated medical waste is a solid material intended for disposal which is produced as the direct result of non-infectious patient diagnosis, treatment, therapy, or medical research other than those characterized as RMW, which is regulated medical waste. And it says, unless local requirements supersede this policy, like I said, examples include bandages containing very small amounts of blood or other body fluids, disposable catheters that may contain trace amounts of liquid swabs, used disposable drapes, gowns, masks, and empty use specimen containers and urine cups. Non-regulated medical waste requires no further treatment and is disposed of as general medical trash. So a big fancy thing here is to kind of give you some scope or guidance and understanding of what would be considered regulated medical waste and what wouldn't. So obviously the pad that has a little bit of blood on it, the Band-Aid, the little tiny things, those are okay to just be thrown away because the volume at which is there is so tiny. Now, obviously, if you have a Chuck's pad that is just doused in blood and essentially is just soaked to the core, yeah, you're probably not going to throw that in regular trash and you would get rid of that appropriately. Now, this next little part here is talking about regulated medical waste and what is that definition here? So, regulated medical waste is essentially just waste that is controlled because it could have harm on the environment based off these different characteristics and could possibly pose a health risk. That's all you need to know between non-regulated medical waste and regulated medical waste. Differentiated right there. Now, obviously, the military likes to make it complicated and give you a million different options of things that you could discard and how you would get rid of them, which will be discussed at the very end of this section of this instruction. But there are 9 groups right here. Now, is this possibly going to be a test question? What is group 1, 2, 3, 4, 5, 6, 7, 8, 9? Yes, it very well could be. If you want to remember all 9, awesome. I will give you 2 thumbs up. But I want to advise again that this is a lot of just familiarization and being able to narrow down on a multiple choice test. And the fact that there's not many questions from here, you can retain this to memory and that would be awesome, but not totally necessary. I'd like you to be more familiar with it. That way you can kind of cover everything. And if at the end of your study sessions, you're able to get back to this and remember them, awesome. We will test you at the very end of this video. So there's group 1, which is cultures, stocks, and vaccines. Group 2 is pathological waste. Group 3 is blood and blood products. Group 4 is used sharps. Group 5 is animal waste. Group 6 is isolation waste. Group 7 is unused sharps. Group 8 is other. And Group 9 is chemotherapy trace waste. The next part of this instruction kind of also goes over a little bit of the definitions, because if you don't understand definitions of some of the basic terminology, you're not going to really grasp what's going to be seen later on, and we can see some basic questions from this section. So they go biosafety level. I see here there are 4 levels, 1 to 4. They don't really go over them other than stating here that level 4 is the most stringent and applies for the work with dangerous and exotic agents that pose a high individual risk of life-threatening disease, which may be transmitted via the aerosol route and for which there is no available vaccine or therapy. Throughout the rest of the instruction, it does not mention anything other than level 4. And it repeats it throughout this. So you might want to just understand that level 4 is the most dangerous and is known as being dangerous because it is not known what can be used to vaccinate against it. And essentially that it is transmitted via aerosol route. As you can see here, I'm going to kind of skim over some stuff that's pretty basic, like cultures and stocks. You talk about blood and blood products. I think those are pretty basic, understood things. Dual waste, waste that qualifies as both a regulated medical waste and hazardous waste. I can see that being a test question as what qualifies as both regulated medical waste and hazardous waste. One of the options there being dual waste. And again, this repeats itself throughout the instruction is what is hazardous waste? Like I said, hazardous waste is solid waste or combustion of solid waste, which because of its quantity, concentration, or physical, chemical, or infectious characteristics may cause or significantly contribute to an increase in mortality or an increase in serious, irreversible, or incapacitating reversible illness. Or B, pose a substantial present or potential hazard to human health or the environment when improperly treated, stored, transported, disposed, or otherwise managed. For my FMF guys that are out there that have obviously had to study that book, this is on there. You had to know about hazardous waste, and this is exactly what's in the book. And I'm not sure about surface warfare as well, but this is something that does repeat itself throughout many different literature throughout the military. So this is something you might want to contribute to your memory because I'm sure you will see this again. Again, it reinforces the regulated medical waste, non-medical waste, and it says non-regulated medical waste is waste generated in the healthcare setting which is non-infectious and requires no additional treatment before disposal. Pathological waste. So this highlight is essentially saying, like, if you get something removed from your body that is obviously able to carry pathogens, that would be considered. So like it says, organ, tissues, body parts other than teeth. Okay, because that will be an entire thing in this instruction as well of how to discard of teeth, if the patient wants to keep it, if it's being used for some kind of training situation or scenario, or if you're just trying to get rid of it. They talk about all 3 of those methods at the very end of this as well. But it says products of conception and fluids containing tissue removed by trauma or during surgery or autopsy or other medical procedure. And again, it covers regulated medical waste in the definition, which I would say this is likely going to be on the test if you're going to see it. But it says waste. Regulated medical waste here says waste generated during diagnosis, treatment, and immunization of humans or animals and is capable of causing disease or would pose other adverse health risks to individuals or the community if improperly handled. As you can see, I'm skipping through some things that, like sharps, you should know what we're talking about if you're a corpsman, obviously if you're taking the test. Chemotherapy trace waste. I include this because not many people really understand about chemotherapy other than maybe it's used for cancer and things like that. And it's not very common. If you're a pharmacy tech and you dealt with vials that had chemotherapy drugs in them, you probably have dealt with this. But if not, you're probably like, I have no idea what this is. So this is essentially needles, empty vials, syringes, gowns, and tubing that contain chemotherapeutic pharmaceuticals or were exposed to those pharmaceuticals during treatment of the patients. These wastes must be classified as empty, less than 3%. You will see that as a common theme in this of the less than 3% contained still in that vial. And it says that to meet this definition, and the waste of this nature that are not classified as empty must be managed as bulk chemotherapy waste per another reference, which is not part of your study material. So understanding that's your scope of understanding this right now. So now we're to a very, I would say, boring part of this of who's who does what. Obviously, Bureau of Medicine, which writes this instruction. Do you guys know the name of the instruction? I gave you the first part, BUMED. What? BUMED instruction 6280.1 Charlie. it does go down further. And kind of where I think that you're going to need to know more about this is you have the environmental program manager, which is the EPM. Then you have the environmental point of contact, also EPOC here. First of all, we have the environmental program manager. Now, if you're a person that's been stationed in a place that has several outlying areas, such as I would say like Japan, where Yokosuka Naval Hospital there is like the hub, that person would have the EPM there, and they would be overseeing as the other outlying areas such as Sasebo, Iwakuni, Etsugi would have the EPOC, which is like the representative for their local sites. Now, the EPM is the person that kind of is the overarching program lead for all of this stuff, and the EPOC does the same thing. They just don't see over all of them per se. So the EPM is supposed to ensure that regulated medical waste is identified and managed according to the existing regulations and policies, including adherence to the most stringent requirements applicable to the site as followed. Like I mentioned, if it's something locally that is in Japan that's a little bit more stringent, you're going to follow that, and they would make sure that you guys do follow that. But if not, they would follow this instruction, which is the BUMED instruction 6280. They will provide day-to-day management of the regulated medical waste program at the parent command and oversee subordinate commands, including ensuring proper segregation, collection, storage, and preparation for transport and record keeping. Now, I like numbers for the exam, and that's why I'm going to cover this part, and that is because it says the EPM must take the environmental training within 1 year of appointment. That will be key. 1 year of appointment. I've seen this question on the test before, and there's a couple numbers. Like I said, you're going to have to know the 3%. If it's that volume or less, then you can put it as part of the regulated medical waste. If you're looking at something like this where it's training, it's 1 year out, and then we will get into a couple other numbers that are kind of key for this instruction. Now, the EPM is the person that is going to sit here and create the medical waste management plan. So as you guys know, during COVID, for example, people were not able to engage, right? And we're talking about medical waste has to be taken out. Maybe that's by a contract. Maybe that's destroyed on site where you're stationed at. Whatever the case may be, there were issues there, right? So the medical waste management plan would have to make a plan. What if somebody can't pick that up? What if the contract person gets in a vehicle accident and the waste that's there can't stay there any longer? What will you do in order to make these changes, and what are your contingency plans? And this is like an evolving thing, as every place is going to be a little bit different. Like I said, if your local area is more stringent or less or whatever else. Now, that EPM is also going to ensure that there's training records up to date, because remember, they are overseeing, right? The EPM's here, big guy. The EPOCs, which are the points of contact for that, those people are going to have to be trained as well. And so obviously they're going to have some kind of training record, but also on top of that, they are responsible to visit all these sites once a year. For the sake of keeping up with my Japan analogy here, the person that is stationed at Yokosuka would have to make a trip every year down to Etsugi, down to Iwakuni, down to Sasebo to make sure that their programs are up to date. And that way, if they ever get inspected, they know that they're doing the right thing. And obviously, the person that is the EPM, is that overarching person, is going to actually be able to guide or give some kind of information if there are questions that do arise. And like I said, with the EPOCs, they pretty much are going to mirror and be like an extension of the EPM, of that program manager, and they're going to have that training within the year. They're going to enforce all the regulations. They're going to do all that stuff. That way they make sure they're compliant. And that way when the EPM comes down, they're not going to get any lashings of bad talk, essentially, because they didn't do what they were supposed to or whatever else. So they are truly just an extension. Now let's get to where you guys come in with regulated medical waste. So a lot of us are doing this. We have sharps, we have medications, we have all these other things that we're disposing of all the time during patient care. Now, a lot of you guys don't think about it, but you guys are handling medical waste on a regular basis, and that's why this is still relevant and important. Here it says that the employees, you guys handling the regulated medical waste, are going to segregate this at the point of generation, or the point of origin is another way that you could say this. Meaning, like, when you have a sharps container, you don't like wait to put it in the sharps container and have a sharps there. You have to walk over, put it in. Whereas if you have a blood-filled chucks pad, obviously you're not going to throw the sharps and that all together and say, oh, we'll sort that later. No, you're going to segregate that at the point at which that is being generated. Now the containers that you have. All non-sharps regular medical waste must be placed in containers appropriate for the waste that are clearly marked with the universal biohazard symbol labeled with the word biohazard and red in color. So I'm going to post a photo here. That way it maybe sticks in your brain a little bit longer, because honestly, I think if you don't see it, you're going to probably forget it. And that way, I'm going to keep this on the screen and you're just going to keep looking at the colors. And remember that we are talking about a biohazard symbol that's universal, labeled with the word biohazard and red in color. Now, obviously, as you have regular medical waste, which might be sharps or whatever else, you're going to make sure that you have this bin lined with some kind of plastic liner, which they have obviously some arbitrary specification, which you're going to have all this stuff stored at. So it says here that the regular medical waste must be lined with the manufacturer's requirements to meet the 165 gram impact strength and also the 480 gram tear strength. Don't know if that would be a question, but it's a number, so let's take a gander and say it might be on the test. And those bags must be red or orange. It must have the universal biohazard symbol as well, permanently marked on the outside. Now it says here, sharps must be collected in a rigid red or clear containers that are puncture resistant and manufactured specifically for the collection of sharps, and must be marked with the international biohazard symbol as well. Again, the biohazard symbol seems to be a trend that we're seeing throughout all this. If you have not seen a sharps container, here it is. Keep looking at it, because some of you guys have never even drawn any kind of blood since you were in core school and you've worked in patient admin, and now you're trying to learn this instruction because you want to make rank. Congrats. Here it talks about the regulated medical waste containers, where they're saying they always have to be closed. So if you're leaving the area, close it. Don't have it open, right? But if you're like doing a shot X or exercise and you're doing multiple shots, for example, and it says here the container may be considered in use, however, when the workers leave the area for lunch or whatever, right? So if you are doing that shot X and you leave and then it's still open, that's okay, because you're going to come back and still put more stuff in it. But it must be closed at the end of the time period that you're there, and you must drop that off. Remember those groups I was talking about that I was like, I don't know, commit to memory? They're going back over through them and talks about how you're going to separate them and kind of go into the nuance of it. But remember that 3% rule. It says empty less than 3% of capacity. Remaining vaccine vials and nasal mist vaccine dispenser may be replaced in the sharps container for treatment and disposal, even if the vaccine previously contained thimerosal. Don't even know what that is, but I will tell you 3%. We talked about it with chemotherapy drugs. We're talking about that again with the immunizations here. Number 2, pathological waste must be placed in a rigid, regulated medical waste container lined with a compliant bag and labeled appropriately. Remember, we talked about that red bag that has to have the biohazard symbol on it as well. Continuing. And it says pathological waste may be double bagged in a compliant regular medical waste bag. Ethical considerations may dictate using alternate means of disposal, such as cremation or burial by a licensed mortician. Now, what they mean by that is if there was like a stillbirth or something like that, you may want to obviously work with your mortician to dispose of the fetus at that point. And that is not going to just go in a regular bag, because that would obviously look very bad. So please do not do that, because I'm sure you are asking for a case of NJP if you ever were to. Now remember, we're talking about pathological waste here. So waste must be immediately refrigerated upon generation. If the waste is to be maintained on site longer than 24 hours, it must be placed in frozen storage, okay? Those are numbers I've seen on the test. So refrigerated immediately upon generation of which you have that pathological waste, or if the waste is being maintained on site longer than 24 hours, you have to put it in frozen storage, okay? Extracted teeth are not considered pathological waste. However, they are considered regulated medical waste. Again, later on in this instruction. Extracted teeth with amalgam are considered dual waste, as they contain hazardous waste, which is amalgam, and potentially infectious waste, which is the extracted tooth. There is an entire flow chart of this later on, and it even says here, now extracted teeth without amalgam are to be placed in compliant regulated medical waste bags for disposal. So the main deciding factor is, does it have amalgam or does it not? I thought this might be a test question here. Extracted teeth may be used for educational purposes. However, they must be maintained per guidance provided by the Center for Disease Control. Obviously, who would that be in compliance with? The CDC. It next says placentas are considered pathological waste. It says if a patient requests to take her placenta home, the following requirements must be followed. So there are a lot of people that are out there that believe that the placenta has a lot of nutrients and is still viable to be used for those nutrients. So if you ever want to Google something out there, there are people that make capsules with the placenta inside of it and take those after they have their child because they feel like they could still recapture that stuff and don't want that to go to waste. And that's one of the beliefs that are out there. So that's what they're kind of referring to when they get into this subject. However, it has to follow these few guidelines. It says if the provider determines the placenta must be further examined by a pathologist and the patient will not be permitted to take the placenta home. Obviously, they don't want to get any pathogens outside that facility if they can avoid it. And it says if the patient has a communicable disease, the patient will not be permitted to take the placenta home. And then it also says the provider will then put that in a bag here and then put the patient's name and label it. And then at that point, after that, it is now the patient's responsibility to take that off-site immediately via a cooler or whatever else because they can't return it back to the medical facility. Group 3 is bulk blood products. Bulk blood may be disposed via sanitary sewer. It says blood products are, such as blood bags, blood filter tubing, items saturated, dripping, or caked with blood, like I've mentioned in my analogy here, are to be disposed into compliant regulated medical waste bags because this would not be considered non-regulated medical waste, such as a trash can. Groups 4 and 7 are sharps. Discard all sharps into the sharps containers. Obviously, I assume in core school they've continued the embarrassing yelling sharp, 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 walking around the room like a crazy person until it ends up in a sharps container. So this should be known and committed to memory, even though you probably have never touched another sharp if you're working in admin or something like that. Group 5 here is animal waste. Now, obviously not very common to deal with this, but I'm going to cover it because it's in the instruction. So it says animal waste from animals exposed to infectious agents during research, production of biologicals or testing or pharmaceuticals. Waste from treatment of non-infectious animals is not classified as group 5 animal waste, but classified as regulated medical waste. So, group 6 here is isolation waste. So this is talking about bedding, sheets, stuff like that you might want to deal with. Group 8 is other. And then group 9 is your chemotherapy trace waste, which we talked about. But the main thing that I want you to understand from this is not like any of the other containers that are for regulated medical waste. Chemotherapy is required to go into a yellow container. Now, I have personally dealt with these. It's just a different color. That's it. The next part of this instruction is going to go on to how you store things. Like we've already said, if you are going to have pathological waste, it's got to be refrigerated immediately, or if it's going to stay there for a while, you should probably freeze it. But it's going to go into that also delivering stuff because we know that not every facility has a way to treat the medical waste on site. They might have a contract where they send that out to, and there are things that guide that and who can do that and when they can do that. So on-site transport and storage. So meaning if it's there and that's what you're doing within the confines of the gate of which you're stationed at. It says minimize human exposure during transport. Obviously avoid putting it in chutes and things like that. You want to make sure it doesn't have a chance to spill. And it says pathological waste must be refrigerated immediately and frozen if it will remain on site longer than 24 hours. And again, that repeats itself. If frozen, pathological waste may remain on storage on site up to 30 calendar days. Okay. So we said, if it's going to be there, refrigerate immediately. If it's going to be longer than 24 hours, it needs to go into a freezer, but it can remain in storage on site up to 30 days. Now we're going into the non-pathological waste, which we're going to talk about where it gets stored at, where some of you guys maybe have put the bins in there, you document the weight, you put your name, where you're coming from, all that in this little book, and then magically some guy comes, takes it, it disappears. Now, that is something here where it says that the unrefrigerated final storage for regulated medical waste is held off, await off-site transport or disposal for up to 7 calendar days. So, meaning refrigerated, remember that was immediately into a fridge. If it's over 24 hours, you can do it in a freezer. You can store it for 30 days. If it's not a refrigerated thing, it can be put in this storage facility for 7 days, but it must be locked up if it is around people that could have access to it. Now, again, with the signage, they like to ask questions like this. The entrance to the storage area must be labeled as, quotations, biohazard and marked with the universal biohazard symbol. Hopefully, you guys remember what the old one looked like because it still is the same. And it says the signage must be fluorescent orange or orange red with lettering and symbols in a contrasting color such as black. Like I said a little bit earlier, now we're getting into if you have to put this into a vehicle, essentially. You don't want the doors to fly open and stuff fly everywhere, because that would be a bad day if pathological waste somehow ended up somewhere else, or regulated medical waste ended up somewhere else, and that is very bad. Qualified people that are trained to handle spills, how to handle this if something were to happen, things like that. So it says here, you are only able to use a government vehicle if you're going to be in your little compound of where the base is at and transport it that way. But then it goes into off-site transport. So this is where there's likely going to be a contractor, because I doubt you're taking it to another base to get rid of it, but it says it has to be a disposal contractor. Now, the treatment of a regular medical waste is achieved through destruction, such as incineration, or through inactivation by heat, chemicals, or radiation prior to disposal. Now, if you want to go through group 1, 2, 3, 4, all of these and look at how they're gotten rid of, as far as there are some repeating things such as steam sterilizer or incinerated, and you want to differentiate between which one is which, sure, go for it. But I don't think a lot of you guys are going to commit that to memory with this being such a small instruction as well. But if you would like to go back through this and read the source material, go for it. However, this is a number thing that they're going to probably ask that you see on advancement exams on a regular basis. It says steam sterilization must be achieved per equipment manufacturer recommendations. But obviously, if that is not available, you're going to follow this, which is going to be the test question. It says the sterilization requires temperatures of at least 121 degrees Celsius, 250 degrees Fahrenheit, for at least 90 minutes at 15 pounds per square inch. Remember, we talked about that training that has to be within a year for the EPM, the person that's overall in charge, or the EPOC, the people that are the site people that are going to be pretty much in charge of this program. Well, now we're getting into the idea of people that are going to be segregating this waste and actually be dealing with it on a regular basis, which it says all employees with occupational exposure to it should get specific training prior to beginning work and annually thereafter. And it says employees responsible for packaging the regular medical waste for offsite transport or signing the shipping documents and manifests are going to need that initial training as soon as possible, but not longer than 90 days upon assuming duties. And like I said previously, the EPC, the person that is the overall in charge, is going to create that medical waste management plan for contingencies in plan A, B, C, D if you need to get rid of regulated medical waste. Like I said, for every step that you could ever imagine, there's going to be a step here. That is reviewed annually, just like training is done annually. I don't know. Start putting this stuff together, because you're going to need to know these numbers. However, if there is a difference or change, as far as if there's a contract change, if there's, different procedures as far as a COVID regulation thing, whatever it might be, you need to have those changes updated at least 90 days of the annual review or the following significant process change. So 90 days. Keep that in your head. Sounds like a test question. Now, all the training that you're going to do every single year, you have to keep those records on hand for at least 3 years. Now, as far as the records go, for going to document everything here, it says facilities must maintain that shipping document if you get it sent off site for at least 2 years. Now, this number 4 here says, what if you didn't get any document? It says that in the event that this document is not received within 60 days, that's when the EPM, the person that's overall in charge, I think I said another acronym earlier, but the EPM must notify the contracting officer representative for the RMW disposal contract to determine the appropriate means of contacting the transport and receiving facility to trace the disposal. So they need to have that document up until the day it was received by the person. So 2 years for that, 60 days if they're not given that sheet of receipt, and then annually for the training that they're going to be there, 3 years that they can hold on to it afterwards. That wraps up this instruction. I'm going to have a little quiz link down below to a Google Drive where you can look at the quiz for this section and answer some questions. If you have any other test ideas or subjects you want covered, let me know down in the comments below, because I'd like to see what struggles you guys have versus others, as we're going to eventually cover all of them, but I want you guys to actually, give some feedback, and let's see what you guys actually are dealing with or struggling with, and maybe the explanation of context might help out in a video format like this. Let me know down there below, but please make sure you guys subscribe if you guys want to see more advancement videos here on the channel, as we're going to be looking to expand this beyond just the corpsman community, but also other communities as well, as this is probably going to be a good source of information. Let me know down in the comments below.